Jessica, how are you doing today?
Good, how are you?
I'm all right. I see that your doctor has prescribed you Albuterol to take home for this bronchospasm that you've been having related to your asthma. Do you know what Albuterol is? Okay, Albuterol is a drug that works in your bronchioles, the tubes that go down to your lungs to deliver the oxygen. And when you have asthma, your bronchioles, the big tubes, they close down and they get filled with mucus and they get inflamed. And so it's really hard and you're wheezing and trying to catch your breath. And the Albuterol goes in there and it relaxes and it makes those tubes open up bigger. And then it reduces the resistance that the airflow meets so that you can breathe easier in and out and so that you can cough up all the junk in the phone that's in there and get it hard to breathe.
Okay. And that will help with my asthma?
It will help with your asthma. It would also help if you had bronchitis or emphysema.
Oh, okay.
Any type of reversible airway restriction. So I need to know, do you have any dysrhythmias with your heart or any palpitations?
And what's that?
Okay, palpitations are where your heart skips a beat.
No.
Okay. And now I do need to check for drug interactions. And one of the things that Albuterol interacts with is tricyclic antidepressants, such as amitriptyline. Are you taking anything like that?
Mm-hmm.
How about any MAOIs?
No.
Okay. Those would enhance the toxic effects of the Albuterol.
Okay.
And that would not be a good thing for you. Now, beta-blocking agents, do you take any of those?
No.
Okay, because those would cancel out effectively the Albuterol, and then we would see no results at all. And you still have all the hard time breathing. I do need to tell you about some of the side effects before we get to this medication. Some of the side effects seen are nervousness, restlessness, tremors in your muscles, and then the palpitations that we talked about where your heart skips a beat. And then overuse or excessive use of this medication will cause increased bronchospasms where you're using the medication, but it just feels like it's getting tighter and tighter, and that could be a life-threatening situation. So it's really important that you take this medication the way that your doctor has prescribed it, so that it will help you and not be harmful to you. Another thing that you need to limit is your caffeine intake. Soda, coffee, tea, chocolate, those kind of things, because caffeine is a stimulant, will increase the effects and you'll feel more jittery. And we really don't want that. We want you to be able to breathe, but we don't want you to be jittery. So if you have palpitations, that's something that you need to report to your doctor immediately if you have those when you're using the medication. If you notice that you really feel that your heart is racing, you can check your pulse. You know how to do that, don't you?
Yeah.
And then you can get somebody else who knows how to do it. And if your pulse is 20 heartbeats faster than what it normally is before you started using the Albuterol, then that's something that you need to report to your doctor as well. If tremors in your muscles develop from use with this medication, you need to talk to your doctor and a dosage adjustment may be necessary.
Okay.
Now, we're going to be using the inhaled Albuterol, but there are different forms, and I just want to let you know about them. That may be something as an option in the future. So like I said, we're going to be using the inhaled Albuterol today, but it also comes in the form of tablets that you swallow and a syrup that you drink. And those are maintenance medications. They wouldn't be rescue medications for when you're out doing something and all of a sudden you feel your airway constricting and you need to get it open. This would be something that you would take on a regular basis to help prevent that. Okay. The most important thing to remember with those is that they can cause nausea and vomiting. And if you take it with food or a glass of milk, that will lessen those effects. Okay. All right. So, this is the equipment that I have that will be going home with you today to help you manage this. This is called a nebulizer. And what we do with this is one of the fastest ways to get this medicine down to where it needs to work in your bronchioles and your lungs, to open them back up. And what we're going to do, you have the tube here that connects to the machine, and when we turn the machine on, you can hear the air going through there.
Yeah.
The air combines with the medicine that will be in this chamber, and it produces a mist that you're going to breathe in. And this is what the medicine looks like. It gets clear. It doesn't have any smell. Albuterol always has an A on the top, and you can differentiate. Now, to use this medication, I'm going to let you do it. You're going to you can open it like this, or you can twist it off like this. Then you'll twist the top off the medicine and you'll squirt it in there, and then you can close it back down.
Okay.
Here, I can take the trash for you. Now go ahead and fit the mask over your face so that it covers your nose and your mouth. Okay, now there's a metal piece on the top there that you can bend, and it will conform to your nose so that it will create a tighter seal. And then you simply turn the machine on. You can see the mist coming out, and that's the medicine that you're going to breathe in. The most important part of using a nebulizer for the inhalation of the albuterol is to make sure that your breathing is slow and deep. And you're going to use it until the machine runs out, until all the medication is gone. And you'll see that because it will spit and it will sputter, and you'll see a decrease in the mist that's coming out. When you're done using the albuterol, then you're going to take that apart and you're going to rinse it out with water and let it air dry.
Okay.
You're also going to want to rinse your mouth out. One of the other side effects that albuterol can cause is dry mouth. So just by taking water and putting some in your mouth, pushing it around and spitting, repeating it if you feel necessary, will get that medication out of your mouth and it will prevent that dry mouth.
Okay.
Okay. Now I noticed that you're struggling a little bit to get this mask on and off, so I wanted to show you about one of the other options that we have that comes in the kit with your nebulizer. And it's just a different mouthpiece. And it fits on here, and you hold this end in your mouth, and then when you turn it on, you can see the mist coming out, and you're going to breathe through your mouth, not through your nose. And you'll breathe that medication in and out. And again, it will spit and sputter when it gets done, and then you'll take it all apart and you'll rinse it with the water.
And how long does it take?
It takes about 10 minutes for a nebulizer treatment. Now, this can be used as a rescue medication. Do you know the difference between a rescue medication and a maintenance medication?
A rescue I'll keep with me if I have an attack and I can't breathe. That will help it. And maintenance, I'll just be taking all the time to prevent it.
Okay, that's very true. Now, would you like to carry this nebulizer around in your purse or your pocket? Okay, and that's why I wanted to show you. Albuterol comes in an inhaler form. Now, when you get the inhaler from your pharmacy, it will come in pieces in the box. And you simply need to snap them in there, and then you're going to shake it just a little bit to get that medicine in there combined because it is a liquid. And then you're going to prime it 4 times, pushing down like that to get the medication down to where it needs to be, so that the first time you go to use it, it's going to be medicine and not just air. So if you want to go ahead and demonstrate back to me how to put it together and prime it.
I'll shake it.
There you go.
4 times.
4 times, that's right. Now, when using the inhaler, there's a couple important things to know. What you want to do is you want to exhale completely, get all the air out, and then you're going to put the inhaler to your mouth. You'll start breathing in, and then you'll push the inhaler down, releasing the medicine into your mouth. You'll keep breathing in, fill your lungs up, and then you're going to hold your breath. Ideally, 10 seconds would be great. If you can do longer, that's better. But I don't want you to hold your breath so long that you're going to pass out. Okay? And then you're going to fully exhale. Can you show me how to do that? Okay, now your doctor has prescribed 2 inhalations of this. Now, you don't want to take them back to back. You don't want to inhale, hold your breath, exhale, and then do it right again. You want to wait at least a minute. You've got to let that medicine work. So, at least a minute in between inhalations. I did notice that you were having a little bit of a problem timing the breath with the squirt of the medication. And we have a tool that can help you with that, and it's called the spacer. To use the spacer, you shapen the inhaler and you insert it into the end of the spacer. Now when we press the button, it releases the medicine into this chamber. Then you fit the mask part over your nose and your mouth, and you're going to slowly and deeply breathe in and out 3 to 5 times without taking your mouth off of the mask, or without taking the mask off of your face. And that will help that medicine get where it needs to be. You'll get the full effects, and it's not such a problem with the timing.
Okay.
So if you want to show me how to use that. That's great. So does this make you a little bit more comfortable in using the inhaler? And still, even with the nebulizer and the spacer, it's still important to rinse your mouth.
Okay. And the same thing, I'll wait a minute in between.
Yes, you'll wait a minute in between. Now, if you were using the albuterol in addition to another inhaled medication, you want to use the albuterol first.
Okay.
Because the albuterol is what's opening that airway up, and that's going to make a bigger tube for that other medicine to get down and do its job.
Okay.
Now, we wait 1 minute in between inhalations of the albuterol. Do you know how long we would wait in between using the albuterol and another medication?
No.
Okay, 5 minutes is the ideal window.
Okay.
Let the albuterol do its work. Let those tubes, those bronchioles dilate, and then you can use the other medication as directed by your physician. Now, if you miss a dose of this albuterol that you're using for maintenance, if it's getting close to the time that you would take your next dose, don't double up on them.
Okay.
Just take it as soon as you remember, and then adjust your 4 to 6 hour schedule accordingly.
Okay.
When you double up, that's the excessive use that I was talking about, and you don't want to have the acute bronchospasm. Now let me look through the chart real quick, see if there's anything else any other information that we need to have. And I think that's about it. Do you have any questions for me?
Yeah. My cousin, he takes something for his asthma, but it's not albuterol, and it looks kind of like that.
Does it look like this one?
Yeah.
Yeah, this one's called Sopanex. And when you hold them side by side, you can see that they look very similar. They're both clear. They both don't have any odor. But if you look, there is writing on here. And this one says Sopanex. This one says albuterol. Now, for somebody like me who wears glasses, sometimes I can't always see that. And you can simply tell because there's an X on the Sopanex and an A on the albuterol.
Okay.
And it's very important that if you're living in the same house that you don't get these confused, because they do work in slightly different ways. What other questions do you have?
Another question, what would make me wheeze?